Is medication an alternative to treating?
Yeah, so when we talk about treatment options, quite often we start with the least invasive and work our way up to more invasive one. And but the reality is that the less invasive treatment tend to be also less effective. All right, so let's start with medical therapy. Medical therapy means swallowing tablets. Unfortunately, all the medical therapy that's available to us is not treating the underlying disease. They are short-term solutions. They're only masking the symptoms. So they're symptomatic treatments. For example, for period pain, we can use non-steroidal anti-inflammatory drugs, typically like Nurofen, Naproxen, Tungsten, that kind of Voltaren. We all know this is the over-the-counter non-steroidal anti-inflammatory drugs, and for period pain. For heavy menstrual bleeding, typically we use a drug called tranexamic acid. And for short term, it's fine. Tranexamic acid is used in trauma situation, postpartum hemorrhage situation. Is quite effective in reducing bleeding by shifting the balance towards clotting. But there is some concern in some patient who has previous history of clotting disorders, and this might trigger an adverse event. And typically, you can't use this medication if they have previous history of clot in the legs, like DVT, clot in the lung, or pulmonary embolus. And also, we know heart attack and stroke are quite often mediated by clotting mechanism. So by shifting the balance towards clotting, then we might expose the woman to increased risk of heart attack and stroke. So for short term, tranexamic acid can be very safe, and if they don't have the risk of clotting. But for long term, I don't think this is a good solution, and we should have go on to more definitive treatments.
What is more definitive treatment?
Well,
after?
that's a very good question. To start with, a Mirena IUD. Okay, Mirena IUD is a progesterone-releasing IUD. It's a plastic device, and that's inserted in the uterine cavity, and that can be done in the rooms if the woman had previous vaginal birth, but otherwise it can be done under a light anesthetic, inserted in the esophageal surgery as well. So this device leaches out low dose of progesterone over a 5-year period, and it's been shown that can suppress the heavy bleeding as well as period pain. And it can be quite effective in the majority of women. And, but the overall satisfaction rate is only about 56% at 12 months. Why is that the case? That's because up to about 25% of women, at least in the first 6 months, may experience irregular bleeding, spotting, and instead of heavy bleeding. And a smaller percentage of women might experience pain from Mirena IUD, and some others can experience mood swings and depression, anxiety. So some women are quite anxious of having Mirena IUD if they have previous mood disorders. And some are concerned about weight gain and skin changes as well. And but they're rare, but they are documented side effects from a Mirena IUD. So Mirena IUD is certainly one of the perhaps less invasive approach. It's a minor procedure, and it can achieve reasonable outcome. The other definitive treatment would be, of course, in the past, is always a hysterectomy. Failing conservative management, hysterectomy is quite often on the card, and that's very often offered by the gynecologist to women who has finished a family and who have failed conventional conservative therapy. But this, as I said, this is the 21st century. We have a very effective alternative to hysterectomy, which is UAE, in other words, uterine artery embolization.
We'll get to UAE in another chapter when we continue to talk about adenomyosis. But also I wanted to know, should women wait for menopause before starting treatment?
That's a very good question. That's a very common advice out there. But is it a good wisdom? Now, adenomyosis is a benign disease. It is dependent on the presence of estrogen for the disease to thrive. Estrogen doesn't cause the disease, but presence of estrogen is needed for this disease to progress. Until menopause, every month, women will have an estrogen surge. And that estrogen surge is going to make the adenomyosis a little bit worse each month going forward. So if you wait for menopause, waiting for what? You're not going to get better by waiting. It's not like if I hurt my shoulder or my elbow playing tennis. We know that if we wait and see to let it heal, it will get better. But this disease is an estrogen-dependent condition. It's not going to get better by itself. It's not going to get better by waiting. And also, around perimenopausal time, it can become more difficult to manage because around that time, the period can be irregular. So quite often women get caught off guard because they don't know when the period is going to come. It may be on the public transport, maybe on the board meeting. You know, the teachers may be in the classroom.
When you least expect it.
Exactly. And when it comes like a vengeance and it catch you off guard. So around menopausal time, quite often, if the woman have heavy period, it's actually more difficult to manage. So is it a good wisdom to wait for menopause? I'm not sure.